That's right. It's time now to bring in our guy, Dr. Jeff Pierce, Michigan Sports and Spine, WSN Injury Insider. Dr. Pierce, how are you, my friend?
I'm good. I'm a little worn out. I've been in school. Did my last day of high school today.
Take the parents to work day today, or take the parents to school day?
Yeah, basically. It's sad. It's my last one.
Last kid?
My last kid.
Going through the halls of Cranbrook?
Yep.
My goodness.
Did he tell you saw me?
He did tell me.
He tell you saw me?
He said you were going to give me some of the business on the next show.
I got you, man. I'm going to give you the business about not letting him play football. Come on, man. Let my guy play football.
Come on.
Yeah, see? Yeah, this is an attack.
On,
we set it up. Let my guy play football. Your son is a natural athlete. The way that I saw him draw the ball at your outing, and then I came up to him, he let that boy play football a little bit.
Well, his day's over. He probably didn't tell, he was out for concussions all last summer.
Yeah, he didn't tell me that. You did.
He was out for, I didn't let him play football. I let him play lacrosse, and I don't know if I made the right decision.
Right.
Which is just
the helmets are weaker.
The helmets are weaker and the sticks are bigger.
Right.
But I will say this though, Dr. Pierce, man, you raised an amazing kid. Like, he came up to me, so respectful. Yeah, he's a good one. He's a real good one, man. I like him a lot.
He's like, I want him to come today. He's like, Dad, I just can't do it. I don't know what I'm gonna say. I'm like, just talk.
That's what it's all
him and
about.
His buddies want to come.
They can come any day. Doesn't even have to be at a day that you're here. Just let us know anytime you want to come.
Agreed.
Hey, Doc, before we get, I got to talk to you about real people. Forget about these athletes out here. I got real people out here on the chat. I'm a shoulder sleeper. I sleep like that on my shoulder.
Same.
My shoulder hurts so bad, I feel like I got nothing left there. All I do is I sleep like this, and I wake up in the middle of the night, and I could barely move my shoulder down. What's going on there?
It's probably going to have to be amputated.
Well,
eventually.
I hope not. Well, if it could be this, just as long as it's not this one.
That's right. That's for multiple uses.
He missed you. Yeah, same.
No, is that pretty common?
It's common as you're young, but as you age, you start creating something called impingement. So what you're doing is all the vascular system and the nervous system runs through your armpit. So when you're holding it up like that, you're creating an imbalance. So you're tilting your head to that side because you're not keeping in that neutral position. So you're torquing and pinching the nerves. Then you're compressing the nerves and the vessels that are through your armpit. There's a thoracic outlet.
How do I fix it?
You fix it. We put an airplane pillow on you and duct tape you into a position.
Oh.
No, but honestly, you're going to switch because your body's just going to naturally be uncomfortable. Like, do you ever wake up and you're just shaking your hand out and you got to get it moving?
Oh, yeah.
Yeah, that's your
early
signs. Give it another couple of years of that, you'll be doing it naturally to change, or you got to change automatically.
Bray, you got something similar?
A little bit. He knows a little bit about it. I had like a small tear in my rotator cuff. Stayed out of the gym for 2 months. Finally got the MRI, saw what it was. And once it came back that it was just that, got the shot down there at Henry Ford. And
it's been a steroid shot.
Steroidal shot.
Not the secret cocktail stuff.
I didn't get the secret cocktail sauce, so that's why I'm talking to Doc. Because secret cocktail sauce wears off. Like, wears off faster. Or
no.
Okay. So that's why I'm talking to you. I legitimately have been good. I've been lightweights at the gym, been swimming. But I think a lot of golf still, and I think I thought maybe fatigue, but it was a slight tear, so maybe I'm moving it more. You tell me.
Well, I mean, first of all, you are an ex-professional athlete, so there's a lot extra mileage on you. And now you're trying to,
Allegedly, you know what I'm saying? I'm still young.
It's still young. Yeah. But, we need to tease it out. You're talking about possible impingement. A lot of times when you have a partial tear, everything else grows big around it, and you still have that little deficit there. Like, it's really cool. Like, in the back, like guys that have back surgery, we'll see the repair, and then we'll see actual atrophy of the muscle around it. It's because you didn't get the firing patterns back correctly. Like, there's a firing pattern. There's a natural way of, like, walking, like a gait. Certain muscles have to click in to have a normal gait. For you can overpower it, and you probably left the injured area weaker. So we have to actually turn it back on. It could be as simple as that. But a lot of times we'll do a musculoskeletal ultrasound. We'll look at the dynamic movement of the shoulder.
When am I coming to see you?
The door is always open.
Door is always open.
Door is always open, not just for Braylon, but for Ryan. everybody here at Woodward Sports. We got to keep this group healthy.
I'm dead serious. You let me setting this up because we've been talking.
But what I point out is like firing patterns. When you start not pushing Michigan sports and spy, but I'm pushing guys, doctors, physicians, therapists that work at a different level, and they're not talking my back, but there's a difference. There's a difference. I know Medicare doesn't see it differently, and then I'm getting on my horse for a second. Please. They pay us all the same for that same shoulder visit, right? Medicare sees everybody the same, which is a bunch of BS. My expertise and guys that work at where we peel back that onion a little bit more, like some people are like, well, you just need to do A, B, and C. No, you need to be evaluated to see what the healing was around it, where the muscle deficit is, where the atrophy is, how that ligament's healthy or not healthy. It's not just go lift a little bit more or use that rubber band stuff. You need to get to therapists, and that's what the difference is between working for a professional and then just being a line worker going to some random family practice doctor. There's a huge difference. And, I've prided Michigan Sports and Spine, the people around me that we've done that to the next level. We've always treated people for the next level. And it's sad that insurance dictates where you can't always get that. And people aren't knowledgeable that way. That's probably the biggest reason I enjoy doing things like this is to educate the non-Braylons, the non-beneficial Ryans and things like that. But it's the people out there that are on the chat that want to listen, that don't know any better. Like, I just got a crazy story. Can I keep going?
Please. Here? Yeah, absolutely. I got about 10 minutes left. We'll get to the – no, I'm just saying. I got about 10 minutes left. We'll get to the Lions in a minute, but I want to hear it. This is important.
You guys have accused me don't push Michigan Sports and Spine, but this is a great example of what the difference is, right? We're not some random thing on the corner, an urgent care on the corner, a Henry Ford doctor, a Beaumont doctor. There's doctors, but you need to peel back. What's his education? What is he doing? Is he seeing 40 people a day where he's just like running through the mill, or is he really peeling back what's going on? Unfortunately, medicine today is pushing for getting the volume in because of what they've done. And when I just got questioned on what type of MRI, I can't order an MRI. I'm considered a center of excellence for almost every insurance company. But now, since they want third parties cutting down costs, we now have to do certain things. It's like you've wasted 3 months of this person's life because of your silly ass approval system. So it's getting down to the dollars and cents. You don't have to do that because you have inroads. But the common person, the person sitting out there, the person that's a weekend warrior that doesn't want to give up in his 40s and he's injuring himself at work and wanting to still play, he's the one suffering. Those are the people that are, I want to benefit. Sports and Spine isn't much, we're not just about the elite athletes. We do treat the masses, and we welcome them. We want to see them. This isn't a bit for Michigan Sports and Spine, but it's go for a person that you feel is competent. Look it up, research the guy, make sure he's treated certain types of athletes and things like that. So
can I ask you a question real quick, because you're intriguing me? What should people look for in a doctor? How do people, the regular people, somebody just watching this right now, how do they understand if this is the right doctor for them or not? If this is the right door to walk in or not? What questions should they ask?
You're pushing social media so much right now. They're like, I didn't have a presence on social media, but it's like that's been like when I did for hockey, and that, I guess the best referral is for myself. When I wrote for Hockey Weekly, it gave me credibility, but it gave me credibility to get that person to the door, but my results and how I treated their child or the individual is what kept the referrals coming. It wasn't because I just wrote or I treated a Darren McCarty or I was the Red Wing doctor. But you also have to be someone to get to that level to get that trust. So to answer your question simply, one is their education. Two is what type of fellowship they have. What do they spend time on, right? I always use the example plumber or electrician. You're not going to have an electrical problem and go hire a plumber. You've got to make sure you're going to the right person. You talk about general orthopedics. Well, it's not general orthopedics anymore. Everybody specializes. Is there a reason to go to the guy who's done the most knees in town? Yeah, he probably leads the team in less issues, but he's also done the biggest volume. So it's guys with education. Fellowship trained is huge. Who they're treating, what they're treating, how to interview your doctor. What do you feel about certain things? Like I just had a very prominent person at Cranbrook ask me about an issue with their son that's been nagging for over a year. And he just hasn't gotten to the right person with the right attitude. With, we talk about biologics, we talk about cutting edge stuff. I guess there isn't a simple answer because you have to trust. And a lot of times people go to their primary care doctor and ask. To me, ask the chat, tell me what your problem is, and I'll guide you the right way. That's always been the philosophy of Michigan Sports and Spine, is that come to me, I will evaluate you. I stay in my lane. If I know something's not what we do, I'll get you to that right person. And for me to make a phone call, and get you in, it's like 1 to 2 weeks versus 2 to 3 months sometimes. So, I don't know if I answered your question appropriately, but it's kind of like who you know. But again, we do this show to broaden that who you know attitude. Because if you're friends of Woodward Sports, you're friends of what we do, and we'll treat you with a priority. So that's
awesome. I really appreciate that. Because look, I mean, we all feel very fortunate. You know what I mean? Like Braylon, myself, lots of people we know in the business. You make a call and you get in, but for everybody else out there that is really trying to get the right information and get to the right place and get to the right door. That's hopefully a little bit about what we're providing with this segment here and letting people know, because there's a lot of people listening right now or watching that are still active, that want to be active, that do run into some complications or problems with their bodies, and you want to get them healed.
No, it's just like, not to throw names out there, but I was with Vince Gill, the entertainer Vince Gill. We're on the plane together. He's hobbling off. And I'm like, what's wrong with you? He goes, my knee, I'm not going to do it, and all this stuff. I'm just waiting for it to wear out. I want to stop that attitude. Like we did nursing home work. You don't go to nursing homes to die. You don't wear out your joint until it wears out. I'll get a new one. There's a lot of science right now with biologics and preventative stuff that will maintain your natural anatomy. Mm-hmm. But you need to recognize it early. Like that first little tweak of a knee, you need to not just let it heal, you need to rehab it. You don't underestimate the rehab on it. It's not like just like if you're in your 40s to 60s, it's not like just wait till it wears out and I'll go replace it. That's not the science anymore. And that's what we pride ourselves on. When I talk about biologics or secret sauces, stuff like that, it's kind of what I'm referring to.
Right. Doc, let me ask you a couple of Alliance questions here. I got just a couple of minutes remaining, but Frank Ragnow, big concern with him. He's got a pectoral issue, torn pec, I believe. Look, we hear torn pec, we think C.J. Gardner-Johnson out essentially all season long. Who just had a torn pec also?
This is our third one.
So the third one. I can't think of off the top of my head right now, but sounds like he's gonna not be season ending. How is that not season ending?
Well, first of all, we talked about this before on Darren's show on Big D. It's the amount of what's torn, the amount of muscle. Ragnow he's a beast, right? So I think the first thing I said with that show is that you can't trust him. Right? This guy's going to do whatever he can do to stay on the field. So is he playing it down? Can he do what he's doing? Now that we've identified what the problem is, I mean, he came off the field. I don't think he's playing this week, but they didn't put him on the IR list. So we know he's not going to be out for 4 to 6 weeks either. I think this is something that we see how he does. We need a week or two to see what happens, but he's got to be able to, to resist, to push that defensive guy back and defend and grapple and all that stuff without holding. So he's going to compensate. He's going to let us know. So it's probably not as bad a tear, because if it was a bad tear, he'd be on IR right away. So I think it's that minor tear, probably not close to the bone, because we always worried about where the tear is, how big of a tear it is, and what's the compensating factors. You can't wrap it like a knee or an ankle. You got to be able to have that power come out of his upper body and his strength and resistance. So I think he's not playing this week for sure. I think next week he's going to let us know how he's feeling. So hopefully in 2 to 3 weeks, he should be back.
Stuff, Doc. Good stuff, man. This was actually one of the most fascinating conversations I think we've had in a long time.
The one story about the car, it's a 20-year-old kid who's a long distance runner. He cannot lift his shoulder, above his head, his shoulders or his elbow. And it's like, he's gone to 3 different doctors. I'm like, this can't be rocket science. There's got to be something there. And they ended up, and I don't want to diss on anybody, but they didn't go to the right type of doctor. Like, I was almost amazed or appalled, whatever word I want to use, that it was a perfect example of why we're sitting here, is because you went to the wrong person, you've gotten the wrong diagnosis. This kid's a D1 distance runner, and he's got inefficiencies in his upper body. He can't extend his elbow, he can't extend his arms. So it's, he'll come in, we'll do some ultrasound, we'll find out exactly what's wrong, and at least create a plan and have more knowledge. A lot of people are like, I don't know what's wrong. Oh, look, what did the doctor say? Well, he really didn't say anything. Those are the doctors you kind of shy away from.
Hey, if you're dealing with something, check out Dr. Jeff Pierce, Michigan Sports and Spine, and maybe at the very least, you can help get people to the right situation.
Right.
We certainly appreciate you, Doc. Our WSN Injury Insider, a couple of guys up here on the desk might be on the down low. the disabled list pretty soon with the shoulders. Doc, thanks so much, my man.
Attention sports fans, don't miss out on Expert Sports Injury Insight with Dr. Jeff Pierce of Michigan Sports and Spine. Join Dr. Pierce every Tuesday during Big D Energy and Thursdays during Ermanni and Edwards, where he offers top-notch injury advice. Trust the guy that I trust. Dr. Jeff Pierce is here to keep you in the game and performing at your best. For more information, visit MichiganSportsandSpine.com or call 248-426-9944.